Okay, so now we will be looking at the question: a 5-year-old child present with epistaxis, gum bleeding, and a bleeding time more than 20 minutes, and increase in APTT. What will be the suitable diagnosis? Now, APTT is increased with epistaxis and gum bleeding, and also bleeding time is raised. Most common indicator is von Willebrand disease. In von Willebrand disease, these type of scenarios present positive. Now here is the explanation about von Willebrand disease. In hemophilia, APTT is raised, ITP bleeding time is raised, while in von Willebrand disease both APTT and PT is raised. In DIC there will be raised PT, APTT bleeding time, and FDPs are raised. Also there will be burst cells in the blood, and this is the common typical scenario of bleeding disorders. In this way you can differentiate. Another question is immunity against COVID-19 tumor cells. COVID-19 and tumor cells. Now COVID-19 is virus, and NK cells are increased most commonly in COVID-19. So this is typical presentation of the COVID-19. Another question is first step of thyroid hormone synthesis is oxidation of free radicals. Free radicals are oxidized. So this is the first step of thyroid hormone synthesis. Another question is a female patient present with a short stature, hand, swollen neck, and 20 years of age, having amenorrhea with absent secondary sexual characteristic. Most commonly diagnosis. What can be the diagnosis of this patient? Most common diagnosis for this patient is Turner syndrome, because there is a neck, and a neck is stature is short, neck is short, so the patient has hand swollen. So this is typical presentation of a Turner syndrome. Another question is bone scan is necessary for retinoblastoma. In retinoblastoma, bone scan we perform, and the homosexual male having HIV positive has fever, dry cough, weeks of atypical mycobacteria shown. It is caused by Mycobacterium avium intracellular. Mycobacterium avium intracellular causes HIV positive patient these scenarios. Now this is the question of medical ethics, in which a patient is disoriented, brought in emergency. His wife complains of right flank pain and vomiting. Diagnosis acute appendicitis. Was made in urgent appendectomy. Suggestive patient did not give consent and for surgery. Next step will be the take consent from his wife or from his relative who brought him in the hospital. So this is the typical presentation. B cell marker used in CD19 identification for tumor. B cell marker is CD19. CD19 is B cell marker used